This is Roger Green, host of the Surfing NASH Tsunami podcast. Today we are offering 3 conversations from episode 45, our interview with Tel Aviv Medical Center head of Gastroenterology and Hepatology Oren Shibolet. Plus, from the vault, our conversation earlier this year with Ukraine Director of Health Alliances Tetiana Deshko and Fatty Liver Alliance President Mike Patel. This week's vault conversation reprises our interview from June with Tetiana Deshko, head of Health Alliances in Ukraine. While the challenges she describes 18 months into the Russian invasion of Ukraine are significantly different than those that Oren Shibolet describes 2 weeks after the Hamas invasion of Israel, there are common themes of resilience, courage, and commitment to provide care under dire circumstances. It's interesting that in this episode, Mike Patel, who came to take pictures, became so captivated that he joined in and became part of the story himself. The introduction to this episode speaks for itself, so I'll stop here. Okay, so you might ask, why would we do an episode on this podcast that's not about fatty liver disease? I am in Vienna at the EASL Congress 2023, I think you all know that, and had the opportunity yesterday to go to a press conference where one of our speakers was a woman named Tetiana Deshko, who you will meet in just a moment. And Tetiana is the Director of Programs for the Alliance for Public Health in Ukraine, and she spoke for 8 minutes about the health situation there in public health and some of the challenges that she's facing. For those of you who are on LinkedIn and are connected to Mike Patel from the Fatty Liver Alliance, he posted that. You might want to go back and get it. It was pretty powerful. So Tatiana was good enough to sit with me today. As you know, I talk about Ukraine every week on this podcast. So I figure we'll talk about fatty liver on Saturday. But today I think it will be helpful for all of us to hear Tetiana's story. Thank you so much for being able to join us today.
Thank you. My pleasure to be with you. And thank you for this incredible solidarity in your program today. Thank you.
My pleasure. So, Tetiana, do me a favor, just to get started, tell folks a little bit about yourself. We're going to talk about the work you do now in a moment, but what you trained to do in your career and what you were doing before the war started.
Thank you. I'm trained as a social scientist. I have PhD in social sciences, and I've been working for HIV programs for over 20 years now. Ukraine had a massive HIV epidemic that was a developing one of the worst in Eastern Europe and Central Asia. Then the organization I worked for, Alliance for Public Health, stepped in, and we were starting with organizing treatment. When we started, 137 patients were on treatment. So it was a tiny number of patients. But then we received international support with the Global Funds funding, and we were able to scale up the program to thousands of patients. And then it was successfully handed over to the government, and Ukrainian government really responsibly stepped in. It took it over and started to fully fund it and implement it. So it's been a great successful story. But working with HIV in Ukraine, it was an injecting drug use-driven epidemic. Of course, we got in contact with hepatitis C, and up to now, hepatitis C is very prevalent in people who inject drugs. It's 68% prevalence among 68% in the injecting drug user population, which is quite big in Ukraine. It's over 300,000 persons who are injecting drugs in Ukraine.
Now, just for people who don't know, total population of Ukraine is what, about 50 million?
No, it is such a difficult question to ask. Yes, it is about 42. Yes, maybe 42 million is the population of Ukraine. The migration has been very severe after the war started. It's about 15 million people moved outside of Ukraine or within Ukraine. So it's about 30% of Ukraine's population. They have moved.
So when the war started, how did you transition your role to what you're doing now? And then we'll talk about exactly what you are doing now.
Before the war, we focused on HIV programs, on hepatitis programs, on TB programs, prevention, diagnostics, and linking to care, procuring medications. But you cannot offer a hepatitis C test to a person who is escaping shelling or who has no place where to stay or what to eat. So it was a natural and immediate choice for us to follow the needs of our patients, to follow the needs of our people. So we had to do many more new things. So when the war broke out, it was all around Ukraine, and we had to, but of course on the east and the south, the fighting was most severe. So we get engaged into evacuating people. We had vans that we used earlier for diagnostics, for transportation of medication. So we started evacuating people with those vans. We started to deliver medications to people because the logistic chains were broken and pharmacies were then closed down in many areas. Hospitals didn't get treatment. treatment. So we, with the vans that we had, we started to transport treatment, to transport humanitarian aid. Then we had organized shelters for people who moved from east or south to the west. We helped them to locate in their new locations. We received international support to do that. Many of the international donors and bilateral donors have supported us to do so. So we had the opportunity for that. But it always continued. We were preparing for the cold winter, and we knew there would be gas shortages, but then our electricity supply was severely damaged by Russia. So we had to buy wood and and blankets to warm people who relocated to other parts of Ukraine. So yes, it has been a massive expansion to the role of a public healthcare professional. And it continues up to now. We have to deal with daily new challenging situations. In the explosion on Kakhovka Dam, for example, people had to be taken care of, had to be brought to new locations. Their houses need to be repaired, and they have to be relocated to the safer places and support provided for them.
Now, does the Alliance Public Health, does their mandate include repairing their houses, or is that done otherwise?
Now it does. When families from the east of Ukraine would go to the west of Ukraine, we would look for some houses, like abandoned houses in villages where people don't live anymore. So we help to repair them, to arrange water supply, to arrange gas supply there, and then help these people settle in the new places. So we did a purely humanitarian things, but also, alongside with continuing our major focus. Of course, it was critical to sustain our HIV programs, our hepatitis programs, so we had to rearrange. We had to organize testing and treatment in the territories which are very close to the front line. So we arranged for mobile clinics, the ones that we have, to actually go to these very close to the frontline territories or the occupied territories and provide the necessary support there. Well, doctors had to wear bulletproof vests, they had to put on casks, they had to be trained on the risks of mined territories, and we always were very cautious about this situation, because in the beginning of the war it was a very sad situation when our partner organization, they were delivering antiretroviral medications to the north of Ukraine, and then the van was hit by shelling and all of the people that were in the van were killed. So we always knew that it's a very big responsibility. So we always coordinated with the local military administrations, with the local administration, so that people are safe. And now when the van comes to the territory like that, they come to, some of the areas are severely hit by shelling, the houses standing without roofs. So they come to maybe to a square in a village like that, and it seems like there is no one there, but then after 5-10 minutes, people start coming from almost nowhere. And most often these are older people, the ones for whom it's very difficult to move anywhere. They're not mobile, or some of the patients that are not movable, and then they're carers as well, so they have to take care of them. And there we provide like electrocardiograms, pulse oximeters, we do rapid tests, we do hypertension measurement of pressure, we provide basic medications, we do rapid tests for hepatitis, sometimes for HIV when we see that it's a possible risk. For COVID, get some humanitarian aid to these people, so it's all very different. So our doctors, they're mainly general practitioners, and they're providing broad medical advice in these situations, and provide some mental health support as well, because people in those territories, they're quite left alone in these situations with their health programs, with their communication, very limited communication in a very stressful situation.
People don't live in Ukraine. Can you paint them a picture of what your typical day looks like right now? I understand the idea because there is no typical day, but what a day might look like.
Well, it is unimaginably barbaric situation that is happening to a nation in the 21st century, unimaginable. And the people have to be taking guns to fight for their lives. There are many colleagues and there are friends who are fighting on the front lines and who are losing their lives. Daily, people are living with almost anything that can happen any day. It is an anticipation of a tragedy that can happen in the next minute. A lot of shelling is happening across all Ukrainian major cities. In May, especially when counteroffensive started more actively, we've seen a lot of attacks happening on Kiev. Kiev was primarily targeted. I'm based in Kiev, and every night it would start with air raid siren, and then you hear the fighter jets flying, and you hear the explosions, and it gets as far as you can get. And And sometimes you would go to a shelter, sometimes you would not go to a shelter. But it really, it is a very, very stressful experience. And then you have to be prepared for whatever happens. We have lived through the 24th of February when actually, you would have to. So we knew that the tanks were coming from Belarus, from the north of Kiev. They were approaching Kiev, and the Russian army came as close as 15 kilometers to where my apartment is. They have captured those territories. And what would you take with you if you had maybe half an hour to pack into your backpack?
You have one backpack to take with you. You have a half an hour. And by the way, it might be dark.
Yeah. And this backpack is still in my head, every day. I'm still thinking of what kind of backpack it may be in case shelling starts again. And you have to be thinking about the people close to you, my elderly parents. So definitely they had to be moved, evacuated to other places. And for elderly people, that is an incredibly difficult, incredibly tragic situation. I think this story has not yet been told about how many elderly Ukrainians have died on their way during evacuation, or these people who have stayed in the occupied territories, who have died, those people who are in the occupied territories, but again now lacking any services, any support. This is a very, very dramatic experience, unimaginably. You are expecting a tragedy to happen any moment.
First of all, you talked about having had a drug addiction problem before this. Are addictions worse now?
Well, with addictions, Ukraine still has a significant injecting drug use population, over 300,000 people injecting drugs. Situation with HIV has become a little bit better because of the massive HIV testing and treatment program. Most of people who are aware of HIV status are on treatment. For hepatitis C, situation is very different. So for hepatitis C, about 1.3 million Ukrainians are estimated to have hepatitis C. It is about 5% of the adult population before the war. And unfortunately, only 100,000 of them are in contact with a medical facility. So just like 1 in 10 Ukrainian knows that he is hepatitis C positive. There has been some treatment organized as a co-infection for HIV or for tuberculosis. For example, Alliance for Public Health, we've been organizing these treatments for co-infected patients. They've been going really successfully. People are really committed to treatment, and they see it as a real privilege to receive it. And treatment success rates are very, very high. They're 96% even in the time of war. It has worked so well, but there is no major national program related to hepatitis C. There is no major response on hepatitis, which is so needed. And there is also no international donor who has stepped in earlier or is ready to step in now in the situation Ukraine is with hepatitis. And the situation clearly has become worse for various reasons. The injecting drug use has become more risky because people are less caring about what kind of injection they are using, what kind of syringe, whether they share it or not. It is far from being on the top of their priorities. So there are increased risks with this population. But also, for ordinary people, for disinfection purposes, or for dental clinics, we have had so many power cuts during winter, and I'm afraid that the sterilization standards have become much lower than normally, maybe in some cases. So we may see new cases of hepatitis C in these groups, but also military personnel. I do not have the statistics to share, but our anticipation is that there are many new infections happening because of a blood-to-blood contact on the battlefield and during transportation from the battlefield. So there are many new challenges that need to be addressed.
One of the things I was noticing is, as you were talking about this last thing, your face changed a little bit. It got a little more stressed. It got a little more anxious. This is a tough conversation for you. I mean, I'm assuming you have it every day, right? In some way, shape, or form.
Yeah, I wish I had more solutions for that because it was very important to sustain the programs that we run. And I think we did pretty well on our HIV work, on our TB work. This is where we got support also from the Global Fund, from PEPFAR, from many donors to do this work. But for hepatitis, it is still not so well addressed. And the situation has really deteriorated. And we need to find the solution which we still don't have. We were able to procure some treatment courses, like several thousand courses, to procure some of the hepatitis C screening tests, but this is clearly not enough. We need to do more and much more than that. So this is the concern that we as health professionals have in Ukraine and that we have not settled.
How can you do more? Literally, how can you do it?
Yeah, well, massive screening program for hepatitis C among these groups, people who inject drugs, among the military, alongside with access to treatment, alongside with medications to be provided.
If you could access everybody, do you have enough medication to treat them?
We don't have. Ukrainian budget, 60% of national budget of Ukraine is war budget.
Well, it has to be.
So the government is not really procuring much medication. Most of the medication comes from international donor funds or international donations. But for hepatitis C, there is no such a solution as for now. That's why it is still a burning issue which needs to be addressed. A screening program, confirmatory diagnostics and treatment is really, really what we need.
Do people who are not in the public health system, are they aware and do they think about the public health issues, or are they so stressed with day-to-day life that this doesn't make it into their brains?
They are prioritizing health, not completely, but very significantly. For us, it is one of the major challenges to maintain the contact with the patient, to make sure that he is receiving the treatment, to make sure that he is taking care of himself, more broadly of his health. Even when we come to these occupied territories with a rapid test for hepatitis C, and we invite people to get tested, they say, well, no, I don't care, I don't need it, what do I do with it? So then it's very good when we have humanitarian aid with us, so we start the conversation, we offer some of the hygiene packages, some other things, and then the doctors try to really offer the person to go through the testing. So much more effort has to be made by a medical professional, by a public healthcare profession to bring the person into a healthier behavior style. And mental health is a tremendous issue. People are living under constant stress, under constant expectation of a tragedy to happen the next day. And although there is a wide acknowledgement of that, and WHO has also commented on that a lot, there is no clear response as well. And I'm afraid it will take long time until this stress is over. Our colleagues from the Balkans, their war ended 30 years ago in the Balkans, but up to now they had mental health support programs running for all of these 30 years. So can you imagine how much it's like a snowball really of health issues that you get with a continued war situation like that? It is mental health, but it is also support for the veterans from war who are coming without their legs, without their hands, with other, they have, some of them have got TB, some got hepatitis, they have mental health issues. There are so many things that come together and it grows exponentially. So it is a major and growing public health issue. But Ukrainian community and Ukrainian healthcare communities and professionals, they have been mobilized and they have been so dedicated to support Ukraine in this very challenging situation. It's been tremendous effort and dedication, and it continues to now. People are ready to do whatever they can to support their close ones, to support other Ukrainians. And I'm sure this is the victorious path that we as health professionals and we as Ukrainians are taking. We will win this war, and it will be a prospering and bright Ukraine.
Just might take a little bit of time to get there.
Yes, it's important to think about it already now, and to think about it as not only rebuilding Ukraine, but really reinventing Ukraine. Just these days, the conference is happening in London to speak about how to make Ukraine recover. I think it's so important that we really imagine it as creating a new public health, which is using the latest health technology, which is very cost efficient, which is very patient-oriented. We started to do some telemedicine during war times when migration was occurring, so we should rely more on what technology is offering us. We are now developing virtual outreach worker to provide advice on HIV and hepatitis C. So again, to reduce reduce our costs and to use artificial intelligence to be able to generate advice in whatever situation the person is, of using the better medical drugs that are available or long-acting agents. For example, with the PEPFAR is procuring for Ukraine a long-acting HIV prevention medication, cabotegravir. So you don't have to take it daily, but you can take it once a month. So really having access and having the mindset for these strong and innovative technological solutions, this is something that Ukraine has to start doing now.
What are the challenges that you feel you're having particular success meeting, and what are some of the ones that you wish you could do a lot better with?
Doing more of telemedicine, online, distant counseling, sending medications, multi-month dispensing, sending them by post. All these things have really worked well. We have started some of this work in COVID. We continued it now, and I think this is something that should be sustained. We should really use the modern communication means more. We should use artificial intelligence more. This is something that we have started, and we definitely need to do more. Where we would really like to expand is support to the deoccupied territories of Ukraine. 100,000 square kilometers of Ukrainian territory are occupied. It is about 20% of Ukrainian territory. And when Russian army leaves, there is very little left there. There are no healthcare facilities or close to. No, there are no medical doctors, and there is population with massive health problems. We've been arranging our vehicles, our vans to come to these territories to provide some basic medical aid, but we just have 6 operating there now. We could do many, many more. So we are now actively fundraising. We're looking for donor funding for more vans we could run, at least 10 more, because the need is really, really huge.
So if people listening to this podcast wanted to send money or encourage their companies to send money, who would they get in touch with and how would they do that?
We have on our website a donation page. We have been collecting donations. We were able to procure some sanitary vehicles to work on the front lines. We have procured and handed over 2 of them already. So I would be happy to share the link to the page.
When people visualize Ukraine, listeners, people who aren't in Ukraine, what do you want them to see? What do you want them to think about?
It is a disastrous 21st century tragedy. When I approach Kiev when returning from a travel like that, back from 40 kilometers to 5 kilometers to Kiev, you can see broken houses on all sides. It's on one side or the other side. And this is something that always keeps hurting me. It is so close. It was so close to Kiev. Incredible. At the same time, I also see how this is changing quickly. We can see how the new sidewalks are built, how quickly some of the houses that have been ruined are being rebuilt, and we can see our government making plans for a better city, for a more convenient city. And I always imagine I would imagine my son in a bright and prosperous Ukraine, where he is standing strong and where he is enjoying a prosperous, a peaceful, a strong and a well-developed country that is a strong global membership. That's what I would want the world to see.
And how old is he?
He's 20.
Is he fighting?
No, he's not fighting. He's a student. Okay. So students go to the universities. They can volunteer too, but yeah, he's a university student. Yeah.
So, Mike Patel, as long as you're here with me, you have anything you want to ask Tetiana?
I wanted to know, at the EASL event, at the end of the questions, I, like Roger said earlier, saw that emotion in your face and the pain that you're feeling for your family and your friends that are going through hell, really. And I don't know if you want to comment about how this impacts family life and your relationships.
Well, for Ukrainian families, that's have been really stretched and stressed with the situation, because many of the families have parted. Women with children have left Ukraine, are staying in safer places, because children must not be in Ukraine these days for security reasons, for inability to study, for psychological stress that they are getting. So many of the families are parted, and so there are some here, some are there. Many of the families, many of people are fighting on the front lines. They have volunteered to fight, or they are now being conscripted actively too. So, and every day I open social media, and sometimes it turns into words of sorrow to some people who have died on the front line just recently. And now we see more and more of that as the counteroffensive is happening. It is really coming at a very, very significant human cost. Elderly people people. For them, it's close to impossible to go to bomb shelters every time shelling occurs. And actually, this is would you really want your parents to live, in the elderly age at the situation of air raid sirens and having to transport them somewhere to evacuate them when they nearly die? This is such at moments, and many of them stay effectively on the front lines, and their life is in danger every minute.
And all their health care that they need, because the elderly need more health care, more medications, more treatment, more monitoring, they won't be able to get that like they did before at all, right?
At all. On the front lines, at all. Even supply of basic pharmacy medications that you can get there, anti-cough treatment or whatever, headache, stomach. The pharmacies would, closest to the front line, would not actually organize it at all. So we are also trying to arrange delivery with our events to some of those villages using the governmental program to at least provide some supply needed. Volunteers would sometimes organize it. Those who come to the front lines, they would bring some medications needed for people, but it is far from what people actually need.
Roger, the two things that Tetiana said yesterday that stuck with me, I can't get them out of my head, was that your healthcare workers need to wear bulletproof vests, which you said again today, and they need training on how to avoid landmines. Yeah. And it's just like, that is just incredible.
That's been Russia's MO forever, right? They leave the mine behind them on the way.
Yeah, but as a person going in as a healthcare support person, you shouldn't have to worry about that. So, yeah.
Sure.
My view of Ukraine is a view of prosperous, developed, and strong nation, and this is what Ukraine deserves. We have lived a tremendously difficult year, but we have lived it in dignity, and we lived it in incredible solidarity from people from around the world.
Yep.
The help that we have received, the support that we have received is tremendous, and now in the EASL conference, I sense it again and again, and many of the people have taken Ukrainians into their families, Ukrainian refugees, and maybe some of you have done so. I would like to appreciate you and thank you for that, because we are fighting for our future, we are fighting for our tomorrow, and this is the fight that cannot be lost. Thank you for your solidarity.
But as you say, the country stands with dignity and with courage. Not that any of us would want to find ourselves in the situation you're in right now. But if we did, I think we all hope that we would rise to the occasion at least half as well as you have, because Ukraine's been amazing.
Thank you.
Thanks for taking the time today. Let me repeat once more. We will be posting on our website the address if you want to make a donation to the Alliance, or even better, if your company wants to do something. We'll be back Saturday talking about what happened in the conference. We'll be back in fatty liver on Saturday. Although on Saturday, we're going to be talking about steatotic liver disease because the nomenclature discussion comes to an end. But Tetiana, thank you so much for doing this interview, and thanks for being here and opening all of our eyes. I told probably 15 people in this meeting we're going to do this today, and to a person they said, "Oh, that's wonderful. Tell me how it goes." Because, as you point out, we all are in solidarity.
Yes, thank you. Thank you for that. Together we will win. Thank you.
As Roger started to pack up, Mike asked a question that Tetiana, Roger, and Mike all believed should be in the interview.
So as we were packing up to go, Mike asked a fantastic question, which was,
how do you get in and out of the country? Because Tetiana's leaving the conference, she said. And I said, how do you get back in?
Well, I would fly to Warsaw, the city that every Ukrainian knows these days. I fly into Poland, and from Poland, I will take a bus to the city of Lviv. So buses go regularly, so you don't really have to adhere to special schedule, and it will take about 8 to 12 hours. It depends on how the border control happens. And I will stay in Lviv for a night, and then I will travel to Kiev by car. It will take me another 6 hours, so it will be a long journey.
But you're at risk the whole time, right? Because anything could happen with rockets and.
How much of that first day is in Poland as compared to in Ukraine? I mean, I know Lviv is. How many hours do you drive before you cross the border?
It is about 5 hours from Warsaw to the border, and then the border. Stand as long as it takes.
I would guess that Russia's not going to attack Poland anytime in the near future.
No, but once
no, that's what.
So half the trip she's safe.
Yes.
Almost, yeah. Most of the first day and none of the second day.
Yeah, it's a long journey.
I can't imagine. Never know what's going to happen next.
Yes, but I'm sure you will soon be taking a shorter journey to come to Ukraine to celebrate Ukrainian victory. So,
well, we all have to do that. We all expect to do that.
And now back to Roger.
We hope you've benefited from this recording. If you have any questions or comments about the content of the conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingnash.com. We'll be back next week discussing the liver risk score and some news about our AASLD coverage next month. Until then, stay safe, surf on. We'll see you on the podcast. Bye-bye now.